I'm not telling you what the news is. I'm just letting you know that that's why it's breakfast with the mayor this morning. Breakfast with the big mayor, right, Rogers? The big mayor. The big and important county mayor, Rogers Anderson. So, Teresa, we'd like to thank our partners.
Yes, let's please thank our presenting sponsors, Gresham Smith and Pinnacle Bank.
Pinnacle is great, has been a partner with us for a long time. We have sustaining partners in Atmos Energy and Williamson Health. And I think right now we have a video from Williamson Health. So let's play that video.
Gentlemen, start your engines.
Love this hospital. It's a great hospital. They got great doctors. It's growing. Phil's done an incredible job. All the people that are involved with this expansion.
Our children were born here, and I never will forget, such a great day in our lives, and this hospital will always be associated with our children coming into the world.
Today's ribbon cutting marks one more reason how our independent, freestanding, nonprofit organization is well positioned to meet the region's needs today and into the future.
I'm thankful to know that the Williamson Health Team is committed to making our community stronger, healthier, and more welcoming for the thousands of residents who move to Williamson County.
Our community deserves a state-of-the-art health facility, and today we have delivered on the first phase of our promise. Opening the new expansion of our adult ER is just the beginning of what our community will experience as we work toward the completion of our $200 million project.
A new reception area and 3 private registration stations will smooth the admissions process so that patients can be registered and seen more quickly. Multiple triage rooms and 10 new exam rooms will expedite patient care. These essential elements of our expansion and renovation enhance our patient experience.
We are also delighted to announce that to date, 6 corporate partners have joined Darrell Waltrip Automotive Group in our More For You, Close to Home capital campaign.
No matter where you are in Williamson County, exceptional care is here.
Thank you so much, Williamson Health, for your support. And seeing that video, it's part of our program today, so you're familiar with some of the things we're going to be talking about services being provided, but we also want to thank a few other partners, First Bank and Hazen, as well as Williamson Memorial.
And UHY, Audit, Advisory, and Tax Consulting, as well as WCAR, the realtors.
And we have partners for today. We appreciate the support of Stites and Harbison, as well as Vanderbilt University and Vulcan Materials. Yes. So those are our partners in presenting Breakfast with the Mayors, as well as the great breakfast from Puckett's Grocery and Restaurant, and coffee from our McDonald's franchisee Lion Leadership Group. So thank you, Teresa, and we're going to get started with our program now. Thanks so much. Put it right there. So today's topic is extremely important in our community, and I've been involved, and Franklin Amaro has been involved with the Williamson County Health Council that is operated through the Williamson County Health Department for many years, and then we became involved with Find Hope Franklin, which is an initiative we'll talk about a little bit more coming up. But I do want to say that this is an important topic today, and I know Mayor Moore is disappointed he can't be here. Franklin Police and other first responders responded to, let me just make this very timely for you. Franklin Police and other first responders responded to 2 suicide attempts and 1 death by suicide, all in one day on Friday of last week. There is mental health in our community needs to be a topic that we can talk about publicly and that's what we're doing today. But we're also talking about addiction today. September is National Recovery Month, and we wanted to bring today, as you came in, you got to see some partners in our community who are working both in mental health as well as in addiction. But those are just the tip of the iceberg. They're working with our children. Those are the tip of the iceberg of the organizations working in our community. And we probably could have had 40 booths in this room of organizations that are trying to make a difference in the lives of people in our community. And so we are really appreciative of that, and we're going to talk about that. Now, I missed a slide. I know I did, and so I got to go back to it. And so I'll come back to this topic just a minute. You might have seen I'm wearing this T-shirt today, which is not normally how I dress, but it's the Franklinite T-shirt. And all of you, whether you live, work, just play here, can be Franklinites, and we'd appreciate you looking at those shirts as a purchase option because Franklin Amaro benefits from that. But also importantly, I want to call your attention to our I Voted sticker design contest that we're doing in conjunction with the City of Franklin and the Williams County Election Commission. Does anybody know what happens on October 24th this year? There's a city election. It's very important that you vote. Vote for the candidate of your choice, but please vote. That's part of being a citizen of a community. And I want to encourage you to vote. And so we're doing this I Voted sticker art contest. It's just for fun. These are some of the children's entries and other entries that have been submitted so far. We've got forms on our table. Would love for you to submit an entry. The entries will be open through August 4th, and so we really want to encourage you to be part of this sticker design contest. It's to raise civic awareness about October 24th election, and we hope that you'll be involved. If you're not registered to vote but live in the City of Franklin, you can stop by the booth at the Williams County Election Commission and become registered to vote in the City of Franklin if you're eligible. That's part of being a great citizen. So we're going to talk about mental health and addiction today, and we hope that if you leave here with a purpose and an idea of how you can play a role in providing hope through positive action in our community. And I'm going to say it, and we're going to say it a lot later on in the program, and letting people know they are not alone in their struggle. They are not alone in our community when it comes to mental health and dealing with addiction. So we're going to play a video from Mayor Moore, and I'm going to invite some of our first guests to come on up and join me.
Well, good morning. This may be one of the most important breakfasts with the mayors that we ever have. And we're talking about a subject today that is a serious issue in our community. You know, we live in one of the most caring communities anywhere. Our city regularly receives lots of recognitions for a great place to live and work and retire and raise your family. But in our city, we do have people that are in pain. And these folks need our help today and every single day. The message I want to send to them is they're not alone. And I hope that you'll understand that a little bit later in the program. You know, why is the problem so serious that our fire and police both have mental health counseling as part of their programs? And it's because they see some of the worst things every single day in our community, whether it's related to substance use disorder, overdoses, or suicide attempts. In the past 6 months, there's been 71 calls related to potential suicides, and there have been, in just 2 weeks, 3 completed suicides. I don't have the statistics right off the tip of my tongue as far as the number of overdose cases that we're seeing, but the hospital in their new expansion has created 8 behavioral health beds, and last year alone, they saw over 1,400 behavioral health crises ranging from substance use disorder, overdoses, and just general behavioral health problems. So this is a serious issue in our community that we're going to address today in Breakfast with the Mayors. This is what led me 5 years ago to lead a group of people to form Find Hope Franklin, a group that's focused on raising awareness of mental health issues in our community, addressing suicide in our community, and most importantly, training our community in QPR, question, persuade, and refer. This is how it's analogous to CPR. So I would urge every one of you to learn this morning some about QPR, but also reach out to Franklin tomorrow and consider taking one of their classes on QPR. Find Hope Franklin has a website with some of the best resources that are available for people. And of course the 988 number, which was recently introduced, which is a hotline particularly focused on suicide. I hope you'll listen carefully to the program today and help get the message out that people in pain in our community are not alone, but we're there for them.
So I want to welcome to the stage the big mayor, County Mayor Rogers Anderson, and Dr. Andy Russell and Kathy Montgomery, the Williamson County Health Department Director. Rogers, it's not easy to talk about topics like this, but the county is actively looking for solutions, working with professionals like these, opioid abatement funding. Tell us a little bit about how you feel you've become involved and the county is really responding to this need.
Well, thank you, and sorry that Ken's not here. This is near and dear to his heart, not only being a professional as a physician, but he really took this on several years ago and saw a need and persuaded a lot of us other mayors to get on board, and he's done a great job. Before I answer your questions and comments, today they are burying a wonderful lady by the name of Mary Mills, who has been a crucial part to our community, but even more so serving on the Health Council for so many years, representing all of us in those activities. And so I want to acknowledge her many years of public service and her many years as a school teacher, and she lived to a wonderful old age. I can't tell you their age because many years ago I was at a meeting and a young man asked her the question, "How old are you, Miss Mills?" And Miss Mills just kind of looked at him with those beaded eyes and kind of gritted her teeth, and she said, "You know, young man, a woman that would tell her age would lie about anything."
Well,
so I have never forgot that.
And I don't think she probably ever lied. She had such a golden heart. Miss Mills had such a golden heart. She probably never lied. So we don't really know how old she was. It's all good.
Doesn't matter. When you're talking about the topic, and these are the professionals over here and setting out of the audience, many of you are certainly more involved in it than I am, but I think it's important to look at policy changes. They're very crucial into moving the needle forward, but it's all the work that we're doing in our communities hand in hand with the different innovative programs. I think counties and cities, Mindy, they've got to leverage intergovernmental issues, partnerships, expand their crisis response, and invest in behavioral health in a more pronounced and succinct way of getting it done. If you just look at the job that I have to do, looking at the bottom line in so many of the programs we look at, if we just look over into the law enforcement community, whether it's our jail, whether it's our police department, whether it's our sheriff's department, it's an enormous amount of money we are having to invest into programs that oftentimes should have been invested in on the front end to help keep some of these individuals out of our institutions that we refer to as jails. So it is a wonderful topic you've come up with. I am excited about hearing Kathy and Andy, Dr. Russell, kind of weigh in on some of the statistics that we have here in Williamson County and across our state.
And I'll just, we'll get into our official presentation, but I wanted to say, recently there was a meeting convened. Andy presided over a meeting of those working on mental health in our community, but also bringing in some state resources. And I know there are several people here from the State Department of Mental Health and Addiction. There are lots of people here who are working on this topic, not just at the local level, but for all of us at the state level too. But that meeting, why was that important? What's the first step there, Andy?
Well, we just hosted a mental health forum for everybody in the community, but like you said, brought together not only city and county leaders, but also had, like Dr. Herman from the State Health Department was involved, multiple nonprofit organizations, just to try and all put our heads together to see what we can do to work together to help solve some of these problems.
And so Kathy, back to Kathy Montgomery, our County Health Department Director, there's a county health plan, and mental health and addiction. Tell everybody about the county health plan and the priorities that it contains.
Absolutely. So we had an opportunity to work with Vanderbilt and Ascension St. Thomas on doing a community health needs assessment, which we do every 3 years in our county. And mental health and addiction were one of the top data points that actually kind of rose to the surface when we were looking at all of our data related to health in our community. And some of the statistics, and I'll just try to put this up, is that when we were looking at, for example, substance use in Williamson County, it wasn't just related to drug use, but also binge drinking. Unfortunately, Williamson County has one of the highest rates in our state for binge drinking at 19% of our adults. And then, of course, we looked at some of our substance use and addiction and so forth, and we had 41 individuals who actually passed away in 2021 due to an opioid overdose.
And over 60% of those 41 individuals, that was due to illicit fentanyl in our community. And if you want to study something that's scary, get more knowledgeable about fentanyl and the impact it's having in our community, because people don't know what they're taking. And we'll learn a little bit more about that later. But I just wanted to point out that 60% of those deaths were due to illicit fentanyl.
Right. And the other scary thing for us is that when we look at the average age of first use, it's 14. And that's a scary thought. And this, the other thing to be really mindful about is that our 911 call center in 2022 received over 212 calls for service for opioid overdose. So luckily that was a little bit less than what we saw in 2021 and 2020, but still extremely high.
Yes, and so when we think about that, the impact of that, people are now able to even text to 911 in our community, but our responders are going out, they don't know what situation they will find. We're going to hear a little bit later about some options you can take to lock up your drugs, to have something on hand in case you encounter a family member or someone who has had an overdose, whether accidental or intended. And so we want to carry that on. But there's a lot going on. Addiction often is a source or leads to creating issues of mental health with an individual. And Dr. Russell, you can probably talk about that a little bit, but also Kathy, we'll talk about some of the suicide data. But addiction and coming into the ER, mental health, those are straining our ER, not just at Williamson Medical, but across the region, right?
That's correct. Mayor Moore mentioned we saw about 1,400 patients last year in the ER due to mental health issues. Actually, it's closer to about 1,800. 5 years ago, it was down in the 1,500 range, but each year we're adding about 100 mental health patients in the ER. Unfortunately, what we're seeing as well is 5 years ago, about 25% of those patients we would ultimately need to transfer to a psychiatric facility. Now it's closer to 45% that are having to go to a psych facility because their needs are not being met in the community. They need more intense inpatient therapy.
And so, Kathy, we have some data for suicide data from results from 2013 to 2022. So they've advanced that slide for us. So tell us a little bit about this slide.
Well, we've been tracking suicides in Williamson County since 2013. Now, this comes from our medical examiner's office. So over the last 10 years, we have seen 251 suicide deaths in Williamson County. Unfortunately, most of those occur among white middle-aged men, 40 to 59 years old. And what's really interesting to us is looking at, when we're trying to look at ways and opportunities for us to prevent suicide deaths and so forth, whether it's through our graffiti ads, through social media, we're trying to be very intentional. So we look at the number of deaths per month on average. And it's interesting to us to see that in November and unfortunately the months of June and July are our highest dates or highest months that we have suicides that occur in our county. After that, unbelievably, is the months of April, August, and October. Most people think that most of our suicides occur during the holidays, but in Williamson, that unfortunately is not the case.
And to the men in the room, if you've been in a restaurant in Williamson County recently and gone to the bathroom, you may have seen a Find Hope Franklin ad that looks something similar in colors to this. And that's what Kathy was talking about, the graffiti ads. And we got a grant, if you want to talk about that grant and what we're doing with that, just briefly.
Absolutely. I think it's on a couple of slides here.
Yeah.
We'll talk about this. So Mindy and I did write a grant last year through the Tennessee Department of Health, and we're actually funded to do some suicide prevention social media campaigns, both through graffiti ads and online. And one of the things we're trying to track the number of hits and so forth to our Find Hope Franklin website, because there are a number of tremendous resources for people to be able to access. And the good news is that when we collected our baseline in March, before we posted the ads, we only had about 105 hits to the Find Hope Franklin website, and as of May, we had over 1,500. So we know it's working, and hope people are really accessing those resources.
And I did skip one of Kathy's slides, so if y'all will take that slide, can we go back one slide in the back for me? Thank you. Because this is something that's really important, is access to mental health. That's the other thing that when we score on the health rankings, there are two places that Williamson County is not number one, or we're pretty high on the percentage of binge drinking, as Kathy or someone mentioned earlier, but also in access to mental health professionals. The ratio is out of line. And so Kathy, talk about partnering with Volunteer Behavioral Health.
Yes, and our partners are here today, and we were super excited to have Volunteer Behavioral Health actually utilize our health department, thanks to Mayor Anderson and others. They are utilizing space in our health department. We are one of 2 local health departments in the entire state that actually have mental health services available in our facility, and we are a full facility, meaning that the other facility actually just has it a couple of days a week. They are there 5 days a week. They offer services for individuals who are on TennCare, who are uninsured. So those are the clients that we actually serve in the health department. It's a warm handoff to them if they're there for primary care services, dental, WIC, and we recognize that they need some type of mental health service. We can definitely do a warm handoff, get their assessment, and get them scheduled for an appointment.
And that's taking some of the pressure off the ER, hopefully. There's also access to mental health services as a walk-in basis when you visit Mercy Community Healthcare, which provides great service in our community. The Refuge Center is there as a hotline. There are other sources. But I'm going to turn it over to Andy Russell now. We're going to talk a little bit about behavioral health in Williamson County. And I did take out those first two slides because I know you don't want to do death by PowerPoint. That's really painful too. But talk a little bit about the data that we have, because people often, the first thought is, I'll just take them to the ER. And that sounds good, but talk about what the impact there can be.
Well, Mandy, of course, the ER is always at the ready to take care of anybody that shows up with any sort of behavioral health or any other complaint. So it's never necessarily the wrong decision to come to the ER because we can't provide some help. There might be other options that could provide more specific help for that patient, though, and that's where we like to partner with our outpatient partners who can provide other services and hopefully keep them out of an emergency department. The ER, like I said, we can provide some stabilization, but we don't have psychiatrists on staff that are there in the hospital 24/7. And so unfortunately, at times, it's not uncommon that 20% of our ER beds are full of mental health patients. And that just puts more people in the waiting room who are there for other medical reasons. So it can cause a slowdown at times. And now, as part of our expansion project in the emergency department, we are adding 8 beds, which will be in a secure pod, which will be tailored more for those mental health patients. We can still use that for medical patients if we need those beds for medical reasons as well. But we realize that there is such a need for these patients. We're trying to build our space to accommodate them.
And so the numbers are pretty astounding, and you don't, so someone comes to the ER and to be evaluated in a mental health or an addiction situation, but particularly in a mental health situation, they're not just put in a room and left there by themselves, right? There's a whole process that is pretty labor intensive and intensive in terms of dealing with the individual's needs, right?
Exactly. Everybody gets individualized care, and that begins from the moment they step in the ER and get triaged till they're put in a room with the nursing staff, seen by one of the physicians or mid-level providers. We do have social workers and case managers in the emergency departments do parts of the day. Unfortunately, they are not always there at night or on the weekends. But we do have lots of resources available in the emergency department to help with these patients.
And about how many behavioral visits, we've got this slide, about how many behavioral patient visits are you seeing? And tell us a little bit about that.
Yeah, as I mentioned earlier, we've picked up about 100 patients a year over the last 5 years. We're seeing upwards of 1,800 or so. And again, over the last 12 months, 40+% of those will end up being transferred to a psychiatric facility. And that could be partners like Rolling Hills or Trust Point or Pinewood Springs or Middle Tennessee Mental Health Institute, usually for the uninsured patients.
And if someone comes in a mental health referral through law enforcement, that's a burden. That's an issue there because law enforcement often has to stay with them, and the length of stay is longer for those uninsured.
Exactly. These patients require a lot of different resources, especially in the community. Excuse me. Very often it'll start with a 911 call and a police officer is sent to the scene. A lot of times, since so much mental health is in partnership with drug abuse, those patients can be agitated and the police decide they need an ambulance and an EMS crew there. So now you've got multiple emergency vehicles on the scene. A lot of times they'll even have to call back up, and so it's not uncommon for one of these patients to arrive with an ambulance with 2 police cars or deputies en route, and oftentimes those deputies are there for several hours in the emergency department, which again, it's fantastic that they're there and able to help, but again, it takes them off the street where they could also be doing other good.
And so you do have an intake agreement with Rolling Hills. So tell us a little bit about that. If someone comes in and there's no underlying medical need, how does that work?
So yeah, we partner not only with Rolling Hills, but again, also I mentioned a couple other places in the community, Trust Point and Pinewood Springs in Murray County and Parthenon Pavilion. So again, unfortunately, those places, they're full very frequently. There's such a need for mental health resources. A lot of those facilities frequently do not have beds, and so that's why we partner with as many of the local facilities as possible. But unfortunately, at times, we still have to send people to Lakeside in Memphis, or we send them to Knoxville, or wherever we can find a mental health bed available for them. But unfortunately, it can be several hours away.
Well, thank you so much. This is such important information that we're talking about today about mental health. And I hope that before you leave today, maybe stop back by one of the booths here to learn a little bit about the services that are being provided. I want to just say again, and Kathy, and Andy, and Rogers, we heard this at that meeting, 988 is a great resource, not just if someone is in crisis, but if you need advice, you can text to 988 and get advice on how to interact in a situation, whether that be mental health or substance use, misuse question. You can get some help from 988. You can also, in our county, text to 911. Who'da thunk it, huh, Rogers? Who'da thunk that? It's kind of interesting that you can now text to 911. So, go ahead. It's an amazing thing. I think it's kind of interesting. And texting to 911, I would never have thought that, but there are so many advances. But I want to bring up now two other partners who've been working on this, and bring up Lindsay Wilhelm with the Williamson Prevention Coalition, and you may want to move down one, and Jason Waller, who's a great member of our community and a recovery advocate, and bring them up to talk about a new project and how it got started. And Lindsay, you want to sit over here? Okay. That'd be great. Great. Welcome to the stage, Jason and Lindsay. Good morning. So here's some slides. Here's the advancer. The big green button does that. You can even see if it works. Look, it works. So, Lindsay, the Williamson Prevention Coalition, now that's a new name, but you've been around for a long time doing a lot of great work under another name.
Yes.
What's the Williamson Prevention Coalition?
So we have actually been around since 2012, and you may have known us under the name of Williamson County Anti-Drug Coalition, but now we have adopted this new name, Williamson Prevention Coalition.
And it's more positive. It has a more positive outlook, right?
Yes, we're moving away from that very stigmatizing language to a more, everyone knows that they can get help from us, so.
Great. So tell us a little bit about the work you do.
So we do a lot of education in our community, in case you don't know. We do this around things like tobacco, underage drinking, binge drinking, as we've talked about, and prescription drugs as well.
So you're in the schools?
Yes, we are in the schools, and if I know how to make
big green button.
It's not going forward.
There
we go. We have a great partnership with our local school districts. So as you can see, we've been in the last fiscal year, so that would be 2022 to 2023, 12 middle schools and 8 high schools. And I love this, that we have held 51 unique events. So we take every opportunity that we can to get to engage with our youth and with parents and guardians as well.
So those are great. And then those events tell us a little bit about what kind of events those are.
So with some of those events, so with our youth and our adults and our parents and our guardians, we do things from presentations to parent nights, or we set up tables at athletic events as well.
And so what's some of the things people can do to prevent in their home access to drugs that someone may misuse in a way that is harmful to themselves?
So it's really important that we lock up our medications, no matter what it is, anything from Tylenol to prescription medications as well, because oftentimes misuse starts at home from things that you find in your medicine cabinet. So it's really important that we lock those up. And even from, as young as toddler's age. I have a son who's 3, and we lock up our medications as well, so.
And you have available today, people can pick those, what are those? Lock
so
boxes?
yeah, we have free medication lock boxes. Be sure to stop by the table in the back. Those are free to you. And you can see a picture of what they look like. And in the last year, we distributed 309 of those, so it's wonderful.
And being prepared also is not just keeping your drugs locked away and limiting access, but also being prepared, as I said, in the event someone has a overdose, accidental or purposeful how do you do that?
So first, being educated. That's the first and that's the biggest piece. So we have 2 wonderful regional overdose prevention specialists on our team, otherwise known as ROPES, and they do a lot of outreach and education in the community around overdose prevention and harm reduction. And they also talk you through and train you on how to administer naloxone and Narcan. So you can see them today as well. They are here and they are ready to train you and to answer any questions you have as well.
And those kits are free. If you receive the training, those kits are free, and you can have those in your home or in your office in the event that you might be called on to save someone's life.
You never know when you may run into someone who may be experiencing an overdose. It could be at a school, unfortunately. It could be in the parking lot somewhere. It happens more than I like to say.
And I heard somewhere that Williamson County is one of those communities with a high percentage of people. Everybody has at least how many prescriptions that they've gotten, and they keep them around, or you have those pills and you think, I'm just going to keep those in case that comes back. But getting the drugs out of the home is another great way to protect against an overdose, right?
Absolutely. And it's important that you dispose of any unused, expired medications, and you can do that through the permanent drop box locations throughout the county. So there they are. So we have them at all of these locations, and you can drop them off, no questions asked, to any of these locations. And then we also host every fall and spring a drug take back, and we do that in partnership with our local law enforcement and the DEA. And as you can see, last year we took back about 192 pounds. So that's wonderful.
That's great. And Brett Pritz is here from the DEA here in the local area, and we're going to have him come speak at a Frank Talks. And he and I talked about that earlier, to really dive into this topic of fentanyl and illicit drugs in our community and fake drugs, because they are an issue, right?
I mean, unfortunately, it is. It's everywhere. It's here. And the best thing that we can do is have the knowledge to talk to our kids, talk to our youth, because knowledge is power.
And you're putting information out there through billboards and other access points, right?
Yes. So as you can see, we have done, we did a marijuana billboard. It was wonderful. Talked about edibles and how you may not know if something is an edible because they look like candy. They look like gummy bears, Skittles, things like that, that a toddler sure would not know is something dangerous. We run ads at the DMV as well. Sometimes we know there might be some long waits, so we like to try and push some education out right there. And then in pharmacy bags, so on the back of your pharmacy bags throughout the county.
That's great. And lots of partners, and let's go through that, and then tell us about your upcoming events.
Yeah, so we have tons of partners, and these are just to highlight a few of those. And what we do in the coalition would not be possible without these partners. And we get to talk soon about how those partners really came together to push out this messaging, to let people know that they're not alone.
And so you've got an event coming up, and you've got a couple things coming up event-wise, so tell us about those.
So we have a couple of things coming up. August 31st at East Brentwood Presbyterian Church, there will be an International Overdose Awareness Day event. And in September, there's going to...
September 19th.
There will be an event that you'll learn more about shortly.
Coming up. So thank you, Lindsay. And people can reach out to you all through Facebook, follow Williamson Prevention Coalition, or on Instagram, because that's where the kids are, or they're on TikTok. We haven't quite figured that one out yet, have we?
You're not going to catch me on TikTok now.
We're not going to be on TikTok. Sorry, that's not going to happen. But Lindsay, Kathy, Jason have been working on a project, and you all get a world premiere today of a new project that we've been working on for a year. And this is Jason Waller. Jason, you moved to Williamson County a couple years ago, right?
Yeah.
And
moved here about 16 months ago, and it was a year ago to date almost that we actually met here.
He moved here 16 months ago, and he came to Breakfast with the Mayors within the first year of moving here. How'd you get here?
Through my neighbor Al.
Al
brought
Cranach?
me here and made the introduction, the connection, and hit it off with you, and everything just started to domino from there.
So, what's your story about why you came to Williamson County, and what's your passion for recovery, being a recovery advocate?
Yeah, well, I mean, we really wanted to get out of Southern California. My family, my mom's side of the family is actually from Tennessee. So my grandfather grew up off of Moore's Lane in Brentwood, and my mom was born in Memphis, and I have family up in Clarksville and up in Timms Ford. So there's always roots here, but we really wanted to change a pace and to change a life for our kids, and we wanted to slow things down, and we wanted a more wholesome life. And came here, like I said, a year ago with no intention of having this come to fruition. I mean, I'm somebody that struggled with substance abuse and mental health since a very young kid. Just to give you a little context to that, I can actually identify now through the 20 years of work that I've done that I struggled with substance abuse way before I ever picked up a drink or a drug. And I was a kid at 12 years old that struggled severely with OCD. And I used to wash my hands until they would bleed, and I'd have to put neoprene gloves on with Neosporin in them. But on the outside, I was the kid that was very athletic, a part of the popular group, had a lot of friends, and internally, though, I did not know how to deal with what I was struggling with underneath, and then ultimately that led me to, finding alcohol down the road. And I had parents that loved and adored and did everything that they possibly could to try to support me. Saw a psychiatrist, saw a therapist, but at 12, 13, I did not know how to express what it is that I was going through. I saw doctors, and I would take medication, they'd mitigate the symptoms, and I just kind of went on my happy way. Little did I know that when I took the medication that was, to get me to a place where I can actually start doing the work. And so from there moving forward, as I hit into my early teens, I found alcohol, and that alleviated all the symptoms that I had ended up struggling with. And from there, it was just a rapid downhill spiral. And from the ages of 18 to 23, I ended up going to 12 different treatment centers. I was arrested a bunch, and I struggled a lot. I was in the entertainment business, went through a very public battle with addiction, which was very humiliating and embarrassing, but it's ultimately brought me to the place where I'm at today. To shed light, because I think by expressing vulnerability, it creates humility, and it allows the opportunity for us to open up. And so that's kind of where this project came into place with us as a group here, is if we really want to create systemic change, we have to start the conversation. So we got 38 different individuals of all walks of life. We ended up getting the head coach of the Titans, we got people from the DEA, we got the government, we got musicians, we got athletes, we got entertainers. And we said, hey, let's have a conversation and let's start talking about what we're up against and what's really going on. As you'd mentioned, this is the average age of first-time use in Williamson County is 14. The average age of use in the country is 11 years old, 11 and a half. This is the leading cause of death in America for 50-year-old individuals and younger. And so I think it's something that needs to be done. And so that's why we put this video together, to let people know they are not alone, to let people know that there's all walks of life that experience this. You have an MLB MVP at the peak of his career talking about how he was struggling with the worst mental health case that he'd ever had. And then it's, again, for people that are doctors that are on there that we have that are interviewing. And what is addiction? How do I know I struggle with addiction? What is substance abuse? What is mental health? What are the signs and symptoms? How do I know my son or daughter is struggling? And so we've created this trailer for you guys to watch to get an overview and an understanding of how many people are directly impacted by this. And for whoever's alive today, half the population is going to go through a mental health crisis. And so whether we like it or not, it's not going anywhere. It's here to stay, and unfortunately, I think this is just the beginning before it gets worse due to COVID and all the different things that we had. So I'm just so grateful. I just want to say the last thing, and I'll be quiet, but is just the community is absolutely incredible. The fact that we came here and everybody came together, like I literally broke down in tears the first time I saw this trailer come out, because this would have taken me 8 years to do in California, and this happened in 6 months here. And so the people in Williamson County are just absolutely incredible. Al, this wouldn't have been possible without you, brother. And again, just the whole team. And again, I'm going to thank the individuals after we watch this video that all made it come to fruition, but just really appreciate you guys.
And it really is rewarding and exciting. And when I met Jason here at Breakfast with the Mayors, I went to the next Health Council meeting and I said, Lindsay, Kathy, do y'all know Jason Waller? And they were like, yeah. And I said, well, he's moved here and he really wants to get involved in this. And you all, credits to you too, and Jason and everyone who made this happen. And this is the world premiere of You Are Not Alone. So let's roll the video.
What is addiction?
Anything that starts to overtake and starts to supplant the things that make you you.
A party in a hotel, and the kids thought they were taking, something else, and it turned out to be fentanyl, and everybody in the room died that night.
Alcohol was tragic, trauma, turmoil. We ended up having our daughter, and my husband was on the first floor in detox while I was giving birth to my daughter, Delilah, on the third floor.
He did. He continued to take it and ended up overdosing. And it was the whole mixture of heroin and cocaine that actually killed him. So I lost him at the age of 22. And it's been having to live my life with a hole in my heart that will never be filled again.
What would you say to someone who is currently struggling right now?
That they're not alone. There is no perfect family. There is no perfect child. There's so much help out there. You're not alone.
Just let them know that they're not alone.
I would say you're not alone. Friends, family, loved ones, support groups, people you may not even know that are there for you and want to help you get through this.
This is not a poor person's disease. This is not a dumb person's disease. This is not an intellectual's disease. This is a human disease. And it is so important to recognize that you're not alone and you're not isolated.
There is hope out there. We all go through difficult times. We all have our ups and downs. That's life.
As a parent with a child that may be struggling with addiction, I just want you to know that you're absolutely not alone.
The person next to you is struggling with something too. And to know that you're truly not alone.
Anybody that's suffering with mental health, addiction, you are not alone. There's so many people that are struggling with the same things.
And I want you to know that you are not alone and that there is hope.
To find someone that you're really comfortable with and just start that conversation and just don't be afraid to be vulnerable.
Being vulnerable is tough. Asking for help is such a strong thing to do because the person you're asking for help from is going to need help at some point as well.
Really powerful video, and it started, and so You're Not Alone. Did you tell him to say that?
So it's crazy. So the name, where it came from, is out of the 38 interviews, 33 or 34 of the individuals stated you were not alone. And it became the saying when we were filming, like we were gonna see if the person was gonna say it and be like, yeah. And so that's where the name came from, is literally, it was talk about a God shot and how God just orchestrated this whole component. It was very clear that this was the title of it after doing all the interviews.
And you all spearheaded this project, but you had some great help. And so we want to call names.
Yes.
We want to call names today.
So just real quick, if I can have Creed, Lance, Heather, and Brian from Williamson County TV take a stand, please. Lindsay, Alex, Kim, all from the Williamson County's Prevention Coalition. If you guys can just take a stand, please, wherever you are. And then Kathy and Mindy, you guys are absolutely incredible. I can't thank you guys enough. If it wasn't for everybody that just stood up, it took a village to make this happen. So just so grateful for all of you guys. Appreciate it.
Well, thank you for that. But, I mean, Lindsay, this isn't you produced, along with Creed and these folks, a great video, 3-minute video, sizzle reel, as we call it. But that's not the end, is it?
It is not the end. So if you notice at the end of that video, it links you to a website called
we're gonna pull that up?
youarenotaloneTN.com, and I believe we're going to get to pull that up. There. Yep, you guys can see it. So we created this whole website, and it hosts the interviews for all of our participants, and it breaks them down, and you can actually click on one of those pictures, and it brings up a list of videos, and it breaks it down by question. So if you want to know how Coach Mike Vrabel keeps his players mentally aware and fit, you can learn about that. Or if you're a parent and you want to know, is my child suffering from a substance use disorder? Or where do I go to get help? You can find answers to that and help right here.
And it's so great, and we're so excited to have that. It goes kind of hand in hand with the Find Hope Franklin initiative and with the Find Hope Franklin website, findhopefranklin.com. You can go there for resources, but this will give you information from people who've lived it or who work on this topic and live it every day. And that's what's great about it. And so what's the website?
So it is youarenotaloneTN.com. You can also stop by our table. We have cards with QR codes that will link you to that website as well. But it's just incredible that so many people from so many walks of life, like Jason said, came together. And again, you can hear from people who have been in that situation, or to the support people, the family members, and how you can take care of yourself as well whenever you're caring for someone going through that.
So today we wanted to give you many resources. We wanted to make this something that was useful to you and provide you access to organizations that are working on these topics. One of those that's doing great work in our community is the Refuge Center, and they have an event coming up on October 6th. But before that, Jason, you've got an event in September. Tell us about that, the You Are Not Alone event.
Yeah, so we got a You Are Not Alone event when September 19th, where all of us that were a part of the project are going to be coming together, and we're going to do a live event, similar to Breakfast with the Mayors, minus the mayors. You guys are obviously welcome. But we are going to be just having an open discussion and panel and a Q&A and more education around this, because, again, as I think it's important that we have action associated with the things that we've created. And so, again, we have the video that you can go to, check that out, but again, is the continuation of the steps to keep the momentum going.
And as Mayor Moore mentioned, QPR, Question, Persuade, and Refer, Suicide Prevention, and Mental Health Awareness. Through another grant that Kathy and I wrote, we were able to secure training for 11 individuals in our community who are trained to present QPR classes, which are about an hour and a half to 2 hours long. We have 2 classes set in August 2nd at 1 p.m. to 2:30, and August 16th, 10 a.m. to 11:30. Both of those will be at the Franklin Police Department training room, plenty of easy parking, and a great way to learn a little bit more about this topic and how to respond to individuals who may be suffering a mental health episode or crisis, and how to respond to them, but also how to be aware of what's going on in your community and your surroundings. So those training classes, we'll be sending those out. Those classes are free, and thank you so much to the grant that we got to train those people, and we hope to expand this. And so as you leave today, we just want you to be aware you are not alone. You are not alone. And there is hope through positive action in our community, and we can be impactful. Franklin is a community that cares. As Franklinites, we care about our neighbors and our coworkers and our friends, and we want to provide you with these resources today, and we hope that you'll stop back by the tables. As you leave, maybe pick up a card out front for Find Hope Franklin. It's got the QR code on it. But this, I hope you leave today encouraged by the work that's being done in our community, but know that we continue to need support as we bring these important topics to you today at Breakfast with the Mayors. Thanks for being here. We'll see you on October 31st at Breakfast with the Mayors. Have a great day.